Against another national lockdown, Boris Johnson warned the NHS will be overwhelmed within weeks if no further action is taken. The Prime Minister said overrunning of the health service would be a medical and moral disaster, as figures show that current daily hospital COVID admissions are now higher than at the peak of the first wave. Joining us now, Chief Executive General Secretary of the Royal College of Nursing, Dame Donna Kinnair. Dame Donna, thanks very much indeed for your time today. I will ask a bit about the lockdown. I just wonder what your thoughts are on, we had Sir Desmond Swayne, the MP, on earlier, who said deaths are normal for this time of year, there's no excess deaths due to COVID, and the economic measures that are coming are far worse than the deaths from COVID-19. Your thoughts?
I believe that that's not what our scientists are telling us. We're being told that we do need to lock down. I'm deeply worried about the health service being overwhelmed and being able to treat patients. We've already seen previously that hospitals cancelled elective surgery, meaning patients will miss the treatment that they've been needing. So I think I'm completely aligned to the scientists here. We do need to do something to save lives.
Do you think it's come at the right time?
Well, we always knew, I think very early in March, April, that we were expecting a second peak of some sort. I think that it had been predicted that it would be about October time. So I think we're slightly late, but we do absolutely need to lock down if we're going to not overwhelm the health service.
What sort of different things are the health service doing to prepare? They've obviously been through this once in the spring. We've got those Nightingale hospitals. We had the experience, obviously, of setting up COVID wards earlier on. What might be done differently this time?
Well, we are very well prepared in terms of treatments. We know that things are working, such as dexamethasone and oxygen. So we are prepared from that aspect. I think there is a huge difficulty, and my anxiety is, where are the staff going to come from? We did go into the original pandemic with 50,000 nursing vacancies in the NHS. And even though at that time that we had about 14,000 and students coming forward to help. Many of these have gone back and we've got people going back to provide elective services and other things to keep the NHS going. So we still do have a shortage of staff. So even though we've got ventilators and machines, and we don't have enough qualified or trained nurses to provide care if we do get overwhelmed. So my advice is that we do need to take some measures now so that we don't get overrun.
I think importantly as well, what would your advice be to people who, as of Thursday, get to a place where they don't have COVID, but they feel like they maybe need help and need to go to a hospital? What would you say to them?
Well, of course, we still are running the NHS as an NHS. So actually, my advice to people is, if you still do need hospital services, you do need to go to hospital to receive those services, or to contact your GP. For other people, I'd be saying, the same things that we know that we're doing now. So wear a face covering, wash your hands, maintain social distancing. That's the most effective method of protecting ourselves. And even if you're not concerned about yourself, please be concerned about others, because it is easy to give this virus to other people. It's a tragedy for everybody unless infections come down. And we don't want the NHS overwhelmed. And we also are in the throes of winter.
Yeah, and with that in mind, how is staff morale going into this?
Well, we know when we first encountered the lockdown and we first encountered this virus, everybody was up for it. My concern now is that we are receiving, as the RCN, more than 1,000 calls a month from members about anxiety and stress, and this is only likely to increase. We know at this time our nursing staff is exhausted, and actually, while they've been treating just recently fewer COVID patients, the pressure never, ever went away. And as we can see, we know even if we lock down today, the numbers are likely to rise. So as the cases increase and we're in the second wave, I am deeply concerned about how they are going to be able to cope. And, there is a huge amount of pressure on our NHS staff and nurses. So we've never seen this type of pressure before, and we will struggle to cope unless we deliver a proper plan on how and where patients will be treated.
Given your levels of concern, you clearly are very worried about it. Is there a concern of yours about compliance amongst the general public being asked to do what we're doing in the next month? That actually there are sections of the public that are quite fed up with this and feel like the time was wasted the first time we did it.
I would urge the public to continue following the rules and the restrictions, because actually, when you think about the risks that nurses and other people providing health services are taking, we do need compliance enabled to see off this virus. It is a tragedy for everyone. So my urge to the public is to continue to comply with the restrictions, wear a face covering, wash your hands, maintain social distancing, and stay indoors so that you do not pass the infection on or get the infection yourself. As I said earlier, it's a tragedy for everyone, but unless we can bring the infections rate down, we will be overwhelmed. So my urge is to please comply with the restrictions.
It's not just the United Kingdom, obviously, that's facing this. Lots of countries in Europe have gone back into a lockdown. But lots of other countries on the other side of the world and in other places, seem to be dealing with this slightly better. Given the experience we went through earlier in the year, the slightly more peaceful situation over the summer, but now coming into what we're seeing now, do you look back at the summer and think, when you look at other countries and you look across the world, there are some things we could have done better here?
Well, we'll always be able to learn and have done things better. I think it's been incredibly difficult because unless you're in another country, you can't always rely on the stats that are being given. I think that what we have seen is that we have been a bit late to apply some of the things like wearing of masks, but actually we can do so much now. So for me, it's about making sure that we comply with the lockdown that we know is coming, that we think about those that are putting their lives at risk and on the front line, and do our best to protect the older people and our friends and family.
Dame Donna Kinnair, thank you very much for speaking to us today.
Thank you.